Hey everyone, welcome back. Today we're diving deep into AI in medicine, but not just the cool technology. We're focusing on how doctors in British Columbia are being told to use it responsibly. And it all comes down to this fascinating document from the College of Physicians and Surgeons of BC, the CPSBC. You might be thinking, well, isn't this just for doctors? But trust me, as AI is used more and more in healthcare, we all need to understand how it's being used ethically,
Yeah.
especially as patients, right?
You know what's really interesting here? This document isn't just about the AI you might expect, like those super advanced robots you see helping out with surgery. It's actually trying to bridge a gap in how we regulate AI in medicine.
Okay, I'm intrigued. Bridge a gap how?
Well, think of it like this. Health Canada does a fantastic job overseeing all the official medical devices,
Hmm.
especially those using AI. But there's this whole other world of AI tools that doctors are using every day. Like you might have heard of those AI scribes. Well, they're not really classified as medical devices, so they fall outside of those strict regulations. So it's like the early days of the internet, where everyone was kind of figuring things out as they went. You have the official rules, but then this whole new frontier emerges. That needs some guidance, right?
Exactly. And that's where the CPSBC steps in, offering guidance on how to use all these new AI tools safely and ethically, even though the rulebook hasn't caught up yet.
So they're kind of setting the stage for responsible AI use in medicine before things get even more complex.
Precisely. And it's also worth noting that Canada is actually ahead of the curve. Back in 2022, they introduced the Artificial Intelligence and Data Act, ADA. It was a big step towards creating a national framework for regulating AI, one of the first in the world.
Wow.
Then in 2023, they released guidelines just for medical devices that use machine learning.
Wow. So Canada is laying down the groundwork for how we use AI in healthcare, both for the devices themselves, but also for all these other AI tools that doctors are starting to use.
Exactly. It's like building a safety net to make
Yeah.
sure AI is used responsibly in medicine.
Okay, so we've got the big picture of the regulations and the guidelines. But what about the document itself? What does the CPSBC actually say about how doctors should be using AI?
Well, first and foremost, they emphasize that AI should always be used to help doctors provide the best possible care. It's not about replacing human judgment, it's about enhancing it.
Yeah.
And they make it very clear that patient safety is like the top priority.
So it's like AI is a partner, not a replacement.
Exactly. And to help doctors navigate this new landscape, the CPSBC outlines 6 core principles for using AI ethically.
6 principles. Okay, let's dive in. What's the first one?
The first principle is all about protecting patient information. Privacy and confidentiality are essential in medicine, and that doesn't change just because AI is involved.
Makes sense. People should always have a say in how their personal information is used, especially medical data, right?
Absolutely. And the CPSBC makes it very clear that doctors need to make sure any AI tools they use comply with privacy laws, and that patients understand what's happening with their data. And they even specifically say that identifying information should never be used with tools like ChatGPT.
That's a good reminder. We've all heard stories about data breaches and privacy concerns with AI, so it's good to know that the CPSBC is taking this seriously.
They are. And the second principle builds on this focus on responsibility. It's all about accuracy and reliability.
This is where things get really interesting because AI seems so sophisticated, we might assume it's always right, but that's not always the case, right?
You hit the nail on the head. Even though AI is getting incredibly good at analyzing data and seeing patterns, it can still make mistakes.
So doctors can't just blindly trust what AI tells them.
Exactly. That's why the CPSBC stresses how important critical thinking is. Doctors need to use their training, experience, and judgment to evaluate the information AI gives them and make sure it makes sense for each patient. It's about using AI to inform decisions, not dictate them.
So it's about doctors and AI working together, combining human expertise with the power of these new technologies.
Precisely. And that leads perfectly into the next principle, transparency.
Okay, tell me more about transparency. How does that play into AI in medicine?
Well, imagine you're a patient and your doctor is using an AI tool to help make a diagnosis or to plan your treatment. Wouldn't you want to know that?
I definitely would. I'd want to understand how that AI is being used and what it means for my care.
Exactly. And that's what transparency is all about. The CPSBC says doctors need to be open and honest with patients about how they're using AI. It's about empowering patients to understand how these technologies are being used in their care.
That makes sense. But I imagine it can be tricky to explain these complex AI concepts to patients who might not have a technical background.
It can be. But the CPSBC emphasizes that doctors need to explain things in a way that patients can understand and be comfortable with. It's not about hiding behind these complex algorithms. It's about being upfront and building trust.
So transparency is about more than just saying, hey, we're using AI here. It's about having an open conversation with patients and making sure they feel informed and involved in their care.
Exactly. It's about shared decision-making and respecting patient autonomy.
Okay, so we've covered three principles so far: privacy, accuracy, and transparency. What's next?
The fourth principle focuses on something called interpretability.
Interpretability. I'm not familiar with that one. What does that mean when we're talking about AI?
Think of it this way. AI can analyze massive amounts of data and come up with insights or recommendations. But sometimes those results can be incredibly complex and difficult to understand, even for the experts.
So it's like AI is speaking a language that humans don't fully understand.
In a way, yes. And that's where interpretability comes in. The CPSBC is saying that doctors need to be able to understand not just what the AI is recommending, but also how it arrived at that recommendation.
Ah, so it's like being able to follow the AI's thought process, to understand its reasoning.
You got it. It's like having a translator between the complex world of AI and the human world of medicine.
That makes a lot of sense. If a doctor is going to use AI to help make decisions about patient care, they need to be able to understand and explain the logic behind those decisions.
Exactly. And the fifth principle tackles an issue that's become a major concern with AI in general.
What's that?
The fifth principle emphasizes the importance of monitoring and oversight. It boils down to this AI in medicine isn't a set it and forget it kind of thing. It's not like you just install a program and let it run on autopilot. Doctors need to be actively involved in making sure that the AI tools they're using are actually working as intended, that they're being maintained properly, and that they're truly benefiting their patients.
So it's about continuous improvement and making sure AI is being used responsibly and effectively over time.
Precisely. Doctors need to regularly evaluate the AI tools they're using to make sure they're still appropriate for their practice, that they're being updated with the latest information, and that any potential issues are identified and addressed quickly.
It's almost like when a doctor prescribes a new medication. You don't just hand the patient the pills and say good luck. You monitor their progress, you adjust the dosage if needed, and you make sure everything's going as planned. It sounds like the same principle applies to AI in medicine.
That's a fantastic analogy. And all of these principles, from privacy to accuracy to oversight, they apply to the use of those AI scribes too, which we talked about before.
Oh, right, those AI programs that listen in on appointments and generate notes for the medical record. Can you remind us how those work, and why are all these ethical considerations so important when we're talking about AI scribes?
Absolutely. AI scribes are like having a super efficient note taker in the room with you and the doctor. They use voice recognition and natural language processing to capture what everyone's saying and turn it into a written record. This can be incredibly helpful for doctors, freeing up their time so they can focus more on interacting with the patient.
I can see how that could be really beneficial, especially for doctors who spend a lot of time on documentation.
It can be, but, and this is a big BUT, those same ethical considerations we've been talking about still apply.
So even though the AI is doing the writing, the doctor is still ultimately responsible for what goes in that medical record.
Absolutely. The CPSBC is very clear on this point. AI scribes don't replace clinical judgment. Doctors need to get informed consent from patients before using an AI scribe. Be aware of how the software is handling patient data. And most importantly, carefully review those AI-generated notes before they go into the patient's permanent record.
It makes sense that the responsibility ultimately lies with the doctor. After all, they're the ones with the medical expertise and the relationship with the patient.
Exactly. And that brings us to the sixth and final principle, which is all about recognizing that AI is a tool to complement, not replace a doctor's expertise.
Okay, so back to that idea of partnership we talked about earlier. AI is there to enhance human capabilities, not to make humans obsolete.
Precisely. And this is where it gets really interesting, because AI has the potential to free up doctors to focus on what they do best. Building those relationships with patients, providing emotional support, and making those complex judgment calls that require human intuition and empathy.
So AI could actually make healthcare more human-centered. That's a really intriguing idea.
It is. It's all about how we choose to use these powerful tools. And that's why these ethical guidelines from the CPSBC are so important. They're not just about protecting patients, they're about shaping the future of healthcare in a way that benefits everyone.
So we've been talking a lot about the CPSBC's perspective here in Canada, but is this something that's being considered globally? Are other organizations thinking about the ethical implications of AI in healthcare?
Definitely. The World Health Organization, for example, has published its own set of guiding principles for AI in health. And what's really encouraging is that there's a lot of overlap with the principles we've been discussing, like protecting privacy, ensuring accuracy, and promoting transparency.
So there's a growing global consensus on the ethical use of AI in healthcare. That's reassuring to hear.
It is. And it's really important because AI doesn't respect borders. These technologies are being developed and used all over the world, so we need a shared understanding of how to use them responsibly.
It's like we're all in this together, figuring out how to navigate this new landscape and make sure AI is a force for good in the world.
Exactly. And that brings us back to you, our listeners. You might be wondering, okay, this is all fascinating, but what does it mean for me?
That's a great question. We've covered a lot of ground, from very specific guidelines for AI medical devices to these broader ethical principles. But how does it all connect back to our everyday lives?
Well, I think the most important takeaway is this. The future of healthcare is being shaped right now, and it's a future that will be profoundly impacted by AI. So whether you're a patient, a healthcare provider, or just someone who cares about the future of medicine, understanding these ethical considerations can help you make informed decisions and advocate for responsible AI use.
So it's not just about passively observing these developments, it's about actively participating in shaping the future of healthcare.
Exactly. And that can take many forms. It could be as simple as asking your doctor about how AI is being used in your care, or it could be supporting organizations that are working to ensure AI is developed and used ethically. Or it could even inspire you to get involved in this field yourself, whether as a researcher, a developer, or an advocate.
There are so many possibilities. This conversation has definitely sparked my curiosity about how I can be more informed and engaged with these issues.
That's fantastic to hear, because ultimately we all have a role to play in ensuring that AI is used to benefit humanity, not harm it, especially in a field as important as healthcare.
Okay, we've talked about the big picture of AI in medicine, the ethical considerations, and even what this all means for our listeners. But before we wrap up, I want to go back to the CPSBC document for a moment. Are there any specific takeaways or key points that you think are especially important for people to understand?
Absolutely. One of the things that really struck me about the document is its emphasis on the human element of healthcare. Throughout all the guidelines, the CPSBC repeatedly emphasizes that AI should always be used to support and enhance that doctor-patient relationship, not to replace it.
That's a really important point. There's sometimes this fear that AI will make healthcare cold and impersonal, but the CPSBC is really pushing back against that idea.
Exactly. They're making it clear that AI should be used to empower both doctors and patients to create a more collaborative and patient-centered approach to care.
I love that. It's a reminder that technology should serve humanity, not the other way around.
Precisely. And another key point that stood out to me is the document's emphasis on the importance of ongoing education and training.
Why is that so important?
Well, AI in medicine is a rapidly evolving field. New technologies and applications are emerging all the time, so doctors need to stay up to date on the latest developments and best practices.
It's like any other area of medicine, right? Doctors are constantly learning and expanding their knowledge to provide the best possible care. And now that includes learning about AI and how to use it effectively and ethically.
Exactly. And the CPSBC document is a great resource for doctors who are looking to learn more about this topic. But it's also valuable for anyone who wants to understand how AI is being used in healthcare and what it means for the future of medicine.
So even if you're not a doctor, this document is worth checking out if you're interested in this topic.
Absolutely. We'll be sure to include a link to it in the show notes.
This has been such an insightful conversation. I feel like I have a much better understanding of not just the technical aspects of AI in medicine, but also those ethical considerations that are so crucial.
I'm glad to hear that. And, it's not just about understanding the issues. It's about having a voice in how these technologies are shaped. As AI becomes more integrated into our lives, it's more important than ever to be informed and engaged citizens.
You're right. We can't just sit back and let technology happen to us. We need to be active participants in shaping the future we want.
Exactly. And that's especially true in healthcare, where the stakes are so high.
So before we move on, I want to make sure we highlight one more thing for our listeners. We've talked a lot about the CPSBC, but they're not the only ones thinking about these issues. You mentioned the World Health Organization earlier. What are they doing when it comes to AI and ethics?
The WHO is playing a crucial role in promoting responsible AI development and use around the world. They've published a bunch of reports and guidelines that address those ethical considerations, And they're working with different countries to help them develop national AI strategies that put safety, equity, and human well-being first.
That's fantastic. It sounds like there's a real global effort underway to make sure that AI is used for good in healthcare.
There is. And that's something to be hopeful about. The challenges are real, but so are the opportunities.
It's amazing to think about all the possibilities, right? We were just talking about AI helping doctors with diagnosis and treatment planning,
Yeah.
but it can also play a role in things like drug discovery and personalized medicine and even robotic surgery.
It's true. The potential applications are huge, and they just keep growing. And what's really exciting is that AI isn't just about making things faster or more efficient. It's also about opening up entirely new frontiers in healthcare.
Okay, can you give us an example of what you mean by new frontiers?
Absolutely. Imagine being able to use AI to look at a patient's genes and predict their risk of getting certain diseases like years in advance. Or imagine using AI to create personalized treatment plans that take into account a patient's individual lifestyle and their environment and their genes.
Those are some truly incredible possibilities. It sounds like something out of science fiction.
It does, doesn't it? And it's closer than we might think. AI is already being used in some of these areas, and the pace of innovation is just amazing. But as we've been discussing, it's really important that we use these advancements responsibly and ethically.
That's a perfect point to bring us back to our main topic today, which is the ethical use of AI in medicine. We talked about the CPSBC's guidelines here in Canada and the World Health Organization's efforts globally. But what about the companies that are developing these AI technologies? Do they have a role to play in making sure AI is used ethically?
Absolutely. They have a huge responsibility. After all, they're the ones creating these really powerful tools, and they need to make sure that they're designed and built with ethical considerations in mind right from the start. It's not enough to just think about ethics later on as an afterthought.
So it's about building ethics into the DNA of these AI systems.
Exactly. And that means thinking about things like data privacy and bias mitigation and transparency and accountability all throughout the entire development process. It also means working closely with healthcare professionals and ethicists to make sure that these technologies are aligned with the values and principles of medicine.
It sounds like a very multifaceted challenge, requiring collaboration and communication across so many different fields and perspectives.
It is. But it's a challenge that we really need to embrace. The stakes are too high to ignore. If we do this right, AI can change healthcare in ways that we can't even imagine yet. But if we get it wrong, the consequences could be huge.
So much to think about. As we wrap up this deep dive, what's one key message you want to leave our listeners with?
I think the most important thing is the future of AI in medicine isn't set in stone. It's something that we're all creating together through the choices we make, the conversations we have, and the things we do.
So it's not just about seeing these developments happen, it's about being active in shaping the future we want to see.
Exactly. Whether you're a patient, a healthcare provider, a researcher, a policymaker, or just someone who cares about the future of healthcare, you have a role to play in making sure that AI is used for the benefit of everyone.
That's a really powerful message. Thank you so much for sharing your insights and your expertise with us.
It's been a pleasure. These conversations are so important, and I really hope our listeners will keep exploring this really interesting and constantly changing field.
And to our listeners, thank you for joining us for this deep dive into the world of AI in medicine. We hope you found it informative, thought-provoking, and maybe even a little inspiring. Remember, the future of healthcare is in our hands. Let's make it a future that we can all be proud of.
Until next time, stay curious, keep learning, and keep asking questions.
And that's a wrap on the deep dive. We'll see you next time.